नमस्कार दोस्तों, डीआरवी न्यूज़ में आपका स्वागत है। आज हम एक ऐसी बीमारी के बारे में बात करने जा रहे हैं जो जोड़ों की दर्द से लेकर रीढ़ की हड्डी से लेकर निचले कमर के हिस्से को भी प्रभावित करता है। जी हाँ, उसका नाम है एंकोलॉजिंग स्पॉन्डिलाइटिस, जो धीरे धीरे समय के साथ आपके शरीर में दर्द और जकड़न को लाता है। समय के साथ उसकी जानकारी ना होने के कारण वो धीरे धीरे बाकी हिस्सों को भी प्रभावित कर सकता है। सही समय पर उसका इलाज और जीवन शैली में बदलाव से उसे जल्द से जल्द नियंत्रण में किया जा सकता है। बाकी की जानकारी के लिए हम जानते हैं एमडी होम्योपैथिक डॉक्टर वैशाली पीड़े मैम।
Namaste. This is Dr. Vaishali Bhide, MD Homeopathy. Today we will be talking about ankylosing spondylitis. Now the term ankylosis means fusion or stiffening, and spondylitis means inflammation of the vertebral joints. So when we talk of ankylosing spondylitis, we are talking of vertebral joints which undergo inflammation, and finally it progresses to fusion of the joints. So what actually happens in ankylosing spondylitis, we'll see later. First, let us understand what is the importance of the vertebrae. The vertebral column has total of 33 bones. The most important function of the vertebral column is protection of the spine. Apart from these vertebrae on top of each other have a intervertebral disc in between them, which is a cartilaginous structure, and in between they have joints. These joints allow movement of the spine, which we require for flexibility. Then they also serve as an attachment to the ribs. So the thoracic vertebrae will give attachment to the ribs, which the rib cage will expand during inspiration, right? So that is important during respiration or your breathing. So here we have an entire length of the vertebral column serving different functions. Now what happens in ankylosing spondylitis is it is an autoimmune disease. When we say autoimmune, we mean that the immune mechanism of our own body destroys or attacks the healthy cells in our body. So, because of this autoimmune mechanism, there is a inflammation of the joints. One is the intervertebral disc and the facetal joints. Because of this constant inflammation, what happens is the joints which are supposed to give movement are replaced, or they are covered by thick bands of fibrous tissue. A few years later or little later into the disease progression, this is replaced by bony tissue or osseous tissue. So the vertebrae, which were supposed to be separated by the intervertebral disc, which is a shock absorbing disc, little flexible, is replaced by an entire bony column. And so on X-ray, what we see is a bamboo spine. The spine is seen just like one single rod or column-like structure. The diagnosis is usually done by doing a MRI on an X-ray to see the inflammation or the bamboo spine, which is seen much later in the disease. Blood test that is done is a HLA-B27 test. This gene which is present is usually associated with ankylosing spondylitis. When there are all the symptoms of ankylosing spondylitis, however this test is negative, we still treat that patient as a case of ankylosing spondylitis. So let's see what are the symptoms of ankylosing spondylitis. The first and the commonest symptom that the patient experiences is pain and stiffness of the back. These are usually young people who complain of pain and stiffness. So initial few months or a few years, it is ruled out that it is because of some mechanical factor, it's because of the sports they are playing, or it is because of prolonged sitting or some other mechanical factor. Nobody suspects that this is a case of ankylosing spondylitis. However, a few months, a few years, when we see, when they realize that the backache is lower backache or neck pain is persistent, that is the time they start seeing their doctors. The commonest symptom, as I said, is pain in the back. It could be the upper back, let's say your neck, or the lower back. It usually starts in the lower back. This pain is associated with stiffness. So while they're trying to get out of the bed in the morning, they have severe pain. After some time, or after applying warm fomentation or taking a warm bath, they feel better. Again, when they go to their office or their workplace or their college, they will sit for prolonged hours, and after that, again, the pain gets aggravated. So, every time they are sitting or not moving, rather, the pain is aggravated, and once they get into motion, they do a little bit of exercises, they start feeling better. This is how we suspect ankylosing spondylitis. Secondly, their movement becomes restricted. Later in the disease progression, what we find is they even find difficult to have the full chest expansion. As we have mentioned earlier, that they give attachment to the ribs also. So because of the stiffness, the ribs also are not able to have a full chest expansion. Then again we said that the pelvic bones are also connected to the lumbar vertebrae by the sacroiliac joint. It is connected to the sacrum, right? So what happens later is, because of the stiffness that is and the inflammation, it is difficult to even move the sacroiliac joint. So this is how ankylosing spondylitis affects completely and many functions of the body, including that your breathing is also restricted later in the disease. Secondly, there is stiffness which we feel. Then there could be a curvature which has come on the spine. Because the spine has lost its flexibility, it tends to get curved, or patient may have a stooped posture later on. Along with that, usually there is weakness, there is appetite loss and weight loss. As we said, it is a systemic disease, a disease involving the entire body and showing itself on the joints. So even weakness and weight loss are seen. So we will now talk about the treatment of ankylosing spondylitis. In treatment, we will see two sections. First is the homeopathic medicine and second is the lifestyle management. Homeopathic medicine works well in ankylosing spondylitis. Here we need a detailed case right from the time the disease has started, when the disease is started, which is the first joint to get inflamed, how much was the stiffness, and what is the rate of progression, which means when is the time you notice the first change. Let's say when you got lower backache, then stiffness, and when was the neck pain started. This tells us the velocity of the disease. The velocity is different in different people depending upon the stress that they are undergoing. So although we have called it an autoimmune disease which is linked to a specific gene, the stress that you undergo will determine the velocity of the disease. Hence, we take the case in detail to know what is the sensitivity of the patient, what is the mental structure, what are the probable stress that they will undergo in the future, and what they have undergone in the past. According to that, a medicine is selected so they can cope up better to their stress. When mentally they can cope up better with the stress, physically or body also copes up better. So that's how we select our chronic medicine. And then during the acute flare-ups, let's say when there is a stress or there is a physical stress and the joints have flared up, there is severe back pain or neck pain, and stiffness and range of motion is limited. This is the time we take another history which we call as the acute history to know which medicine comes up in the acute phase, so we can cut down or we can limit the intensity of the acute phase and help them get out of this faster. So we have both the medicine, one for the chronic illness which is in place and second is for the acute flare-ups. However, when they come much later in the disease, let's say they are 60 and they are having this disease for the last 20 years or 25 years, in that case many a times we already see a bamboo spine on X-ray, and this is the time we always take a surgical opinion from a spine surgeon. This is very important as the spine is a very delicate structure. So we need to know everything before we start the treatment. However, in young people, when we start the treatment, the progression of the disease can certainly be halted, or let's say the velocity can be reduced and the patients have good improvement. After a prescription is made, let's say after a homeopathic prescription is made, first thing we observe is that the stiffness should reduce, and second is the pain. These are the two most important things, because when they both reduce, the range of motion gets better, their appetite has to improve, and hence the weight loss also improves. They start putting on weight, the feverish symptoms and the flare ups reduce because the body is getting better. Now we will consider the lifestyle management. As we have seen, stiffness and pain are a major part of the disease. We see to it that they do regular exercises. Patients themselves will tell you the moment they exercise, they feel better. Therefore, regular exercises are encouraged. We ask them to learn the exercises from their physiotherapists and keep doing them continuously, because that helps us long way in the treatment, because that helps in reducing the stiffness. The response that we get to treatment is much better. Second, a good sleep, good nutrition, and a balanced diet is most important, because it helps body's immune mechanism be at its best. So this is the help we require from the patient, which they usually comply, and I'm very thankful for it. At present, I'm working in Dadar West Shivaji Park area at Sapley's Polyclinic, Malik Building, DV Deshpande Mark, Shivaji Park Road number 4, from 10 in the morning to 7 in the evening on all weekdays. You can also follow me on Instagram and Facebook. As you all know, I have published my first book on homeopathic medicines titled Unlocking Dr. Bogus Synoptic Key, Part 1. I am glad to inform that very soon I will be coming out with the second part of the same series, Unlocking Dr.